Takes about the same. Oh, does it make it more official?
Well, the folks in the back, they'll turn it on.
Oh,
Start broadcasting.
okay. So start again? All right, keeping it official. Dr. Brown? Here. Dr. Lunsford will not be here today. Dr. Martin is running a little late. Dr. Peach?
Here.
I am here, so, oh, Dr. Campbell?
Here.
Oh, convenient. All right. We'll go ahead and get started. Approval of minutes from the last meeting of November 18. Any corrections, or I'll take a motion to approve those minutes.
Motion to approve.
Have a second?
Second.
All in favor?
You can't motion because you went.
Yeah.
So you'll have to wait for that too, sorry. Okay.
Okay, we'll come back to that. I hear what you're saying.
Table that for later.
Spring break, the traffic should be better, right? That was agenda item C, which we'll return to. Agenda D, public comment. Anyone for public comment? Agenda item D. Okay. Having none, moving forward to staff reports. Agenda item E1 is licensing division.
Good morning, board members. My name is Laura Hernandez. I'm with the licensing department. Our staff reports, our personnel update. We recently added a new person to our team, and we're hoping to add 2 more soon to have our complete team of 10. I also submitted the staff report, the statistics for the doctors of podiatric medicine and also the radiological technicians. It has the full quarters for 2018-19 and then the first quarter for 2020. I don't know if anybody has any questions about these numbers.
Any questions regarding licensing? Thank you very much.
Okay, thank you.
Customer service, agenda item E2.
Hi, good morning, board members. My name is Jacqueline Rush. I'm with the Customer Service Division. I'm going to be presenting personnel updates and statistics this morning. You have the statistics in front of you. The trends from fiscal year 2018, 2019, and 2020 seem to be pretty much on point from month to month, with our spikes coming in October. If you have any questions on the stats, please let me know. Any questions on the emails or the calls that we've been getting. We have recently started forwarding emails that come in from Podiatry directly to our licensing team to avoid any bottlenecks in our area. So the next time we submit the report on statistics, you shouldn't be seeing any emails. Just to give you a heads up on that. The personnel updates I have for you include we've hired 18 new customer service representatives since November. 6 of them just started in February, and 9 of them started last Monday, March 2nd. So they're in training at the moment. And that's my report. If you have any questions, I'll be happy to answer them.
Congratulations on more people.
Thank you, appreciate it.
Any questions regarding customer service division? Okay, moving forward, thank you.
Thank you.
Enforcement division?
Good morning. My name is Jessica Hurtado. I'm a prosecutor in the Enforcement Division. For the personnel updates, intake, we've hired 3 new individuals to help opening the complaints. And we've also hired 2 new investigators. We promoted 2 of our legal assistants from to legal assistant 5, so they're now in a supervisory position. And we hired 2 new attorneys to work the inspection cases. And finally, our chief prosecutor, John Medlock, was promoted to his position as chief. He was previously the senior prosecutor, and he took Ron Foster's place when he got promoted to our director. And you'll see in the staff report that we've sort of changed up what information you see there. We've added some new things. I think that you're one of the first advisory boards to see it, so if you have any comments or suggestions about it, we'd love to hear that. As for the case highlight, you'll see there was 1 commission ordered entered on November 5th of 2019. This order came after a hearing at SOA. The respondent in the case had applied to renew his license, and the department sought to revoke it based on his criminal history. The respondent had pled guilty to health care fraud in August of 2018. And the commission did revoke the respondent's license and deny his renewal application. And you'll see on the report there, we have listed the performance measures for the current fiscal year. Cases opened for podiatry, we've opened 22 and we've closed 24. The average time to closing is 276 days. 50% of the cases are closed within the 6 months, and 16% resulted in disciplinary action. Right now, there's 64 cases pending. And you can see the breakdown there as the sources of the complaints. 18% are departmental. That means they come from someone in the department. 23% based on a criminal history, and 59% are consumer complaints. And does anybody have questions about the report?
I have a quick question at this
Sure.
point. The number of cases resolved in 6 months is now at 50%. Do you know what that number was in like fiscal year 19?
Let's
If you
see.
don't, I was going to point out that that number is probably dramatically improved.
Yes, in fiscal year 2019, it was 35%.
Fantastic. Fantastic.
Okay. You'll also see that we've broken down the case outcomes, and the penalties assessed was $3,000 and collected so far is $1,250. And you can see the alleged violations at opening. This is not necessarily how the case ends up, but just how it was opened based on the complaint. The most common was gross negligence or malpractice, and then unprofessional or unethical conduct, and the last was, or the third most common was criminal history. And you can see that the violations that resulted in disciplinary action, one unprofessional or unethical conduct, one for the criminal history, and one lacking honesty, trustworthiness, or integrity. And then we've also included the fiscal year 2019 stats. Are there any questions about the report? Comments, suggestions?
Any questions, comments, concerns? Okay, thank you very much.
Thank you. One more thing before I do go, I would just say that we are still looking for some more expert witnesses. So if anybody would like to volunteer their time, and thank you to Dr. Peach, you've been a great help and assistance to us. So.
That was agenda item E3. Agenda item E4, Education and Examination Division.
Good morning. I'm Fanny Pringle with the Education Examination Division. I have no personal updates to report today, but I believe you have our statistical exam information. The fiscal year statistics are also posted on our podiatrist website as well. So our quarterly pass rate is consistent with previous pass rates since the revision of our podiatrist exam. Do you have any questions about that?
Any questions regarding the examination or the results?
All that information is up on the website for new practitioners that are coming into the state, so they have ready access and study materials.
Yes. On our webpage, we have a link to the CIB Candidate Information Bulletin, which provides candidates with an outline of what's covered on the exam, and it also provides a list of reference material where we get our material to create the exam.
Great, thank you.
Mm.
Any other questions, comments? Okay, thank you.
Thank you.
Regulatory Program Management Division?
Good morning. Morning, doctors. My name is Steve Eaker, and I'm here to give you the RPM report. Let's see what we've been up to lately. Staff have led and continue to work on the podiatry implementation teams. The team has been tasked with implementing several bills, including House Bills 2847, 2174, 3284, 3285, 2059, and Senate Bill 1264, which I'll talk about more later. Some of these will be coming up in rule draft that we will be reviewing in the future. Program FAQ pages have been updated, and staff will continue to work on the web pages as needed to reflect rule changes in the continued implementation of the PMP requirements. Staff continue to work with the Pharmacy Board to facilitate registration and educate podiatrists about the PMP program requirements. As of March 1st, podiatrists are required to check the PMP prior to prescribing the opioids, benzodiazepines, barbiturates, and carisoprodol. As of early February, around 56% or 653 podiatrists are registered. Staff also participated in the jurisprudence exam last week to update all of the questions to reflect current rule changes and go over the statistics with regard to the test taking. Now I want to talk a little bit about Senate Bill 1264, which is addresses balanced billing. This has been a hot topic in the news. The legislature decided to act on this in the last session. So Senate Bill 1264 protects consumers from surprise medical bills and emergencies. And in cases where the consumer had no choice of providers, the bill prohibits balance billing by out-of-network providers to state-regulated insurance plan enrollees. A balance bill is defined as a bill that exceeds the applicable co-payment, co-insurance, and deductible under the enrollee's health care plan. Enrollees cannot be balance billed for emergency services provided by non-network facilities and providers, emergency services provided at an in-network facility by a non-network provider, or situations where an enrollee does not have a choice of providers in an in-network facility. The bill does provide an exception for non-emergency care. If the enrollee chooses to use a out-of-network provider for non-emergency care, the enrollee must sign a waiver to acknowledge the waiving of their billing rights and protections. The bill also authorizes TDLR to adopt rules and take disciplinary action against a TDLR-regulated healthcare provider for violations regarding balance billing. So this bill covers state-regulated insurance programs. This is about 16% of the plans in the state of Texas, including the Employee Retirement System, the ERS and TRS. That is all state employees. You can also determine if a patient has insurance covered by the Department of Insurance, because their cards usually have a DOI or a TDI on them. Who is impacted? Providers who work in diagnostic imaging, emergency care facilities, and laboratories and build healthcare plans that are regulated by the state. So what is a facility is a big question, was one of the big terms that needed to be defined, and a facility is an ambulatory surgical care center, a birthing center, a hospital, a freestanding emergency medical care facility, licensed under Health and Safety Code 254, or a freestanding emergency medical care facility that is exempt from licensing under Health and Safety Code Section 254. So currently, the bill is in effect. It went in effect on January 1st for services or supplies provided on or after that date. TDI has adopted amendments and added new sections to the insurance code to implement the provision of the bill. TDI has also adopted emergency rules to implement the waiver provisions of the bill. The waiver exceptions addresses the exceptions to the balance billing prohibitions. So what do people licensed by TDLR need to do? If you work in a facility and provide health care to covered enrollees, you can contact TDI with further questions over the minutia of the responsibilities regarding this bill. And we have their email there, idr@tdi.texas.gov. So, in terms of outreach this year, we are planning on attending the TPMA, Texas Podiatric Medical Association's annual conference in the Woodlands this June, and the Southwest Foot and Ankle Conference in Irving in September. For personnel, we have had some shifting around, and Charlotte Melder was selected as the director of RPM. Charlotte is not here today, otherwise I would introduce her. She was previously our RPM Business and Consumer Safety Section Manager. Prior to doing that, she served as an enforcement prosecutor. In terms of our ongoing activities and projects, MHP staff continue to be busy implementing what passed this legislative session. We have analyzed the impact of several proposed legislation and served on cost estimate teams for the bills that relate to our programs. Staff are continuing to work with the bill implementation teams to execute the requirements of the new laws that were passed. We continue to produce and distribute our health monitor. The latest issue can be found on our program webpage. We're working on that one, turned in our articles last week. Links to previous issues can be found under the agency newsletters on the TDLR page. And if y'all have any topics, please send them to me, and I will get those addressed, and we'll write something. We've been involved in training sessions with the new anti-trafficking team as well, and we have also begun in assisting licensing with the processing of applications this past month because we've had a big backlog. And that is all I have. Do y'all have any questions?
Are you concerned about the 50%, 56% participation in the,
Yeah.
so how best do we as an agency, or you as an agency, address that and
Dr. Campbell,
how best
can
to
you-
resolve
can
and
you speak up?
incentivize people to get on board?
We can't hear you very well. Can you speak right into that mic?
I said, are you concerned about the 56% participation on the pharmacy board ruling that just came out? And what best way does the department have of resolving the issue and incentivizing physicians to get on board?
One thing I think to remember is that not everybody's prescribing these scheduled substances. So there will probably be a ceiling at some point that will not hit 100%. But in terms of outreach, we're certainly open to ideas and suggestions. We're going to conferences, we're sending bulletins and email blasts, and it's on our webpage. The pharmacy board is also doing outreach, so I'm sure providers are receiving bulletins through their accounts with them, through the PMP. And then practitioners in facilities, I'm sure are being told in no uncertain terms to register.
Thank you.
Yeah. Well, I think I'll just add that along that same line, I think the presence of the agency at conferences is tremendously important. That creates, whether it exists or it doesn't, but it does exist, that better communication when y'all are there. And you participate in things that we do, I mean, that's really important. And I think, to your number, I don't know what percentage of people are not going to prescribe just because it sounds like one more hoop that we're going to jump through. But it's like anything, nobody likes change, but eventually they're going to do it. And they'll be forced in mid-March when they write that next prescription or whatever the case may be. So, but it is an interesting number. I figured it would be much higher.
Yes, so did I. And actually haven't had, with regard to other professions, pharmacists have the most. They're at 83%. The PAs are at 60%, but everybody's in the mid to high 50s, or even 18.7% of optometrists. This is as of September of last year. So there's still a lot of work to do in all the health professions and all the people prescribing. It continues to be an ongoing public health emergency and disaster.
Thank you.
Sure. Thank you. All right, executive office.
Dr. Motley?
Yes, ma'am.
I would like us to, of course, acknowledge Dr. Martin's entry into the room.
With a round of applause or simple.
We will take that. And also, at this time, before I give the executive report, Mary Winston, TDLR, can we back it up and take a look at those minutes and handle that?
We would be thrilled to do that in that
Awesome.
order. So we reviewed the minutes to bring you up to date, Dr. Martin. We asked for any questions, concerns, corrections. Otherwise, we were going to take a motion to approve those minutes.
I have no questions.
Okay.
Motion to approve?
All in favor, aye. Any
Aye.
opposed? Okay, so that was going back under agenda item C.
Yes.
Perfect. So now we're back to E6.
All right. Mary Winston, TDLR. First, we want to start off with personnel updates. Since the last time you met, we have had a couple of changes. The agency's had a ton of changes. It's just what we do. But in executive office, we have had a couple of promotions. Carla James retired, and we have 2 new deputy executive directors, David Gonzalez, the former director of RPM, and I'm giving Charlotte another promotion. Christina Kaiser, former director of enforcement. They are joined with our executive director, Brian Francis, to round out the executive leadership of the agency. What's new with us? Also, sunset review process. It's not really new. We've been going through this, and it's the system put in place where sunset staff comes and takes a deep dive into agencies to see if they should even exist, or if they can do a better job, or are they serving Texans best. We're going through that process. Actually, TDLR will have 2 different sunset processes. One for our legacy programs, the older programs that came before, is it what, 2016? And those that came after that date. So they've been taking a deep dive. They've come to many, the staff has come to many meetings, contacted possibly some of you, and they're writing their reports. And I think a hearing, public hearing is going to be scheduled near the end of the summer. And so we'll keep you posted on that. It is definitely a deep dive into the agency, and we look forward to it in that it's going to make us better. That whatever we can do better, we always want to do better for the citizens of Texas and our licensees. Strategic planning is up on us. Starting at the end of this month, staff will be heading out to 5 cities. We've done more in the past, but we've narrowed it down a bit just to ensure we have enough coverage. We also want to incorporate some broadcasts that we can have people call in or get on an app, but we're working on that, and we're keeping in mind that we do have an illness that's working its way through, and if our chances, if our plans need to change, we will change accordingly. But currently, we're heading out to 5 cities, and we always ask these questions: what do we do well? What can we do better? If you were king or queen for a day, what would you change about TDLR? We also ask a question that's left out sometimes when we say that, is what do we expect to change technology-wise in the next 5 years, or in not just technology, but in our society, that will affect your license? What changes will affect your license, and how will that affect you specifically as a practitioner? So we'll be heading out pretty soon to do that, ask those questions. We have strategic planning on the off years from legislative session, and we get that together. We take we catalog every single thing that's said. I've personally been out on strategic planning, and I've had someone tell me, "You suck." And I said, "Thank you. Did you get that?" And he said, No. And I'm like, "No, it's okay. We're taking what you said. We suck. We put that on the board, and we keep it moving." So, and that's okay. We want to know how we're doing, what you think about what we're doing, and we get a couple of good responses to kind of balance those out in general. Communication outreach statistics. This is what we call our non-scientific, but it's just an eyeball view of contact that we've had in the last 6 months. Your program, Podiatry, has had about 107 views a day of our website. That's 19,500 plus views in the last 6 months. 80% of the visitors access the site from a desktop computer, 17% from a smartphone, and 3% from a tablet. This kind of lets us know what platforms work best for each program, and this does change depending on the program. Who uses more of a mobile app, who uses more of a desktop, a tablet, so forth. Tablets haven't had a large number yet. Top reasons for visiting the site: primary source verification, frequently asked questions, podiatry forums, administrative rules, and advisory board. Finally, I'm going to do it says introduction of anti-trafficking unit. They are currently in the field, and I do have the honor of managing that team. We have hired them. They have been training, working with field staff, with enforcement staff, working with different non-government organizations, working with City of Houston, working with several police departments to get a handle on how can TDLR be of assistance in this problem? What is our touch point, and how can we be collaborative in helping to fight human trafficking? We had one person initially, Ms. Jennifer Harless, who was the only person that we had at the time who was sort of triaging the state. She was doing training and whatever she could, but Texas is huge. The legislature, in its infinite wisdom, granted us monies, actually more than we requested, and we really appreciate it, that allowed us to hire 7 more folks to be program specialists and to get out, and for us to have the resources to get out there and assist our enforcement division. We have investigators, but those investigators are awakened, so to speak, are notified of a case when there is a case filed and they're assigned an investigation. Someone has to file a complaint. That happens, and sometimes that doesn't happen. We have our inspectors. Those are periodic inspections. So that's going to happen periodically. There's a time period in there that something can be missed, and something has been missed. And this team of 8 folks is that gray, they like to call themselves the gray in the middle, to try to tie in the times between the periodic inspections and the actual investigations from enforcement. I'm going to just give you the names, and hopefully one day we will actually get them here, but they are in the field. And I'm going to go in my mind's eye from where they sit at EOT. It's Chuck Winkler, Alex Ortiz, Jennifer Ignacio, Ray Carswell, Jennifer Harless, Brian Cottle, Gloria Newton, and Jordan Strain. And a couple of them have had some commerce with TDLR. We have some from the enforcement division, some from customer service, or who have had licensing division experience, but we have others who have just trained municipal police associations actually in strangulation and how that's used as force. And we have folks who've provided other nonprofit assistance with domestic violence and trafficking situations, and we welcome them to TDLR. And I believe that is the end of my report. Do you have any questions?
Okay.
Thank you.
No question. Thank you. All right, next, so that was agenda item E6. We'll go to agenda item F. And I'll leave this up to you if you want to chunk it into 2 parts about amendments on 130 subchapters D, E, F, and G, and do that before proposed new, so we can keep those motions separate, or do you want it as one motion when you're done?
I think we'll probably try and do that as one motion.
Okay.
So what we'll do right now, and Alex Phipps, one of the Assistant General Counsels for this program, good morning, board members. What we'll talk about first are the comments that we received for the rule package that went out after your November 18th board meeting, the one that was published in the Texas Register on January 3rd of this year. I'll talk about the comments that we received, then I'll talk about the 2 changes that staff is recommending that you make to that rule package. So if you have any questions at any time, please stop me. So I'm going to walk through the comments right now. We received 5 comments from 4 commenters regarding the rule package. And the first comment that we received was regarding what improper access to the PMP means. So department staff reviewed this comment and feels that there is no need for changes to the rule package. Chapter 481 of the Texas Health and Safety Code, the Texas Controlled Substances Act, outlines the appropriate use of the PMP. House Bill 3284 outlines a requirement for the department to adopt administrative sanctions for improper use, not in accordance with law. So that would be anything that's not outlined in Chapter 481. We feel that that's an adequate explanation of what improper access is, and so there's no need for changes as a result of that comment. The next comment that we received, one commenter was unsure what human sex trafficking has to do with podiatry. Does not see the benefit of podiatrists learning about the issue. Unfortunately, House Bill 2059 from the last legislative session requires this training, so department staff feels that there's no need for changes to the recommended rule package, as that's a statutory requirement. The next comment actually is 2 comments from the same individual. We have combined those into one because they are similar in scope. This individual feels that the human trafficking course is burdensome, believes resources would be better used in other areas. They also believe that the department needs to outline a waiver for e-prescribing for small practices that write less than 25 prescriptions for controlled substances in a year. The first part of that comment is very similar to the last comment we discussed. HB 2059 from the most recent legislative session requires this training, so there will be no change to the recommended rule package as a result of the comment. The second portion of this actually addresses something that we'll have to take up later on in a future rulemaking. That's the waiver requirements for the e-prescription program. That's not within the scope of this current rulemaking, so that is not going to be something we'll respond to now. But obviously in the future, when we do take that up, we will keep that in mind, and that comment has been provided to the relevant department staff. The last comment that we received is regarding one section of the rule that we proposed, section 130.59, so that's subsection C. This comment is from the Texas Medical Association and outlines a concern about the scope of podiatry and the practice that may be suggesting this subsection that a podiatrist can treat substance abuse disorders. Staff agrees with this comment that it may create confusion. There was no intention when this was drafted to expand or alter the scope of podiatry in any way. So this comment is correct. We agree with it, and we have decided to recommend a change to that subsection to strike the section that may create confusion. And so now I'll talk to you about the two recommended changes that we have. And I have left a copy of these in front of your computers as well if you want to take a look at those. There are two changes that staff is going to recommend. The first change is a recommended change that is not a result of a comment. This is to section 130.44. That's the continuing medical education section. And the changes are in subsection O. Those changes are intended to reflect a consistent term of licensees. You'll see when staff originally drafted this, we used several different terms. Unfortunately, that just is how it happens sometimes. When staff is working on a large rule package, you may mix licensees and practitioners. We did inconsistently use those two terms in this subsection, so we're recommending this change to use licensees throughout the subsection. So we'll be striking doctors of podiatric medicine in the first sentence. We'll be changing licenses to licensees in the third sentence. We'll also be changing practitioners to licensees in the last two sentences of that subsection. If you have any questions about those changes, please let me know, and I'll be happy to address them. Okay. Second change is to subsection C of Rule 130.59. That is the change recommended by the comment from TMA. So what we'll be doing there is striking the entirety of subsection C. So that will be the section that reads, "The 10-day limit does not apply to a prescription for an opioid approved by the United States Food and Drug Administration for the treatment of substance addiction that is issued by a practitioner for the treatment of substance addiction." So we'll be striking that entire section. We'll be re-lettering the next subsection from D to C to reflect the elimination of that section. So if you have any questions about that or any of those changes, I'd be happy to address those as well.
Any questions regarding 130.44 or 130.59? So I take a motion to approve changing or unifying the word licensees in subsection O of 130.44, as well as striking subsection C from 130.59.
Motion to approve.
So that was Peach and then Campbell. All right, all in favor, aye?
Aye.
Any opposed? All right. One motion for you, not two.
Are you okay with that? Do you want to do one more just to recommend that it go to the commission for full adoption?
Yes.
Okay.
So the next motion is those changes moving forward to the TDLR commission based on this advisory board.
Make a motion that that's advanced to the TDLR committee.
Perfect. Second? All right, all in favor, aye?
Aye.
Any opposed? Okay.
Thank you, board
So that
members.
cleans that up. Thanks for doing all that work. That's minutia we may never have seen. I will tell you as a comment, moving forward down the road so we don't repeat things we overlooked like really low volume practices. I think a consensus among anything that we do is if it's something you only do 3 or 4 times a year, you may want to do 0 times a year and leave that to the people that do 90 or 100 of those a year, whether it's prescriptions or specific procedures or things along those lines. Really limited, and this is from our investigation history. It's the little islands that are the most dangerous, the low volumes, the ones that are on special circumstances seem to cause us the most trouble historically. All right, so that was agenda item F. G, recommendations for agenda items for next board meeting. Any of those? Okay. Date, time, and location of next board meeting, I think we can leave that open. We usually have to take a census or a poll of the group to see which times are going to work, but it has been roughly on the 3 times a year schedule. So hopefully sometime in July.
Thank you, Dr. Motley. Sounds about right. I'm not gonna, Alex will have a better date on that, but we do want to reach out to you all and schedule that
Yeah.
closer to that time.
And the way we've been doing in the past really works
It
well.
works.
It's lots of emails, but it works.
Good.
It works. Okay, that completes the agenda. We are now closed at 10:40.